call upon Dr. Triveni Kuttasiri. She is going to speak on clinical outcome between conjunctival autograft and amniotic membrane graft in pterygium.
Good afternoon, one and all. I am Triveni. I am going to speak about clinical outcome between conjunctival autograft and amniotic membrane graft in pterygium. No financial interest. Pterygium was recognized 3000 years ago. It was described by Sushruta way back in 1000 BC in India. And pterygium literally means wing and is an encroachment of the conjunctiva on the cornea, more often on the nasal side, and is found in areas of high ultraviolet radiation, dry, hot, windy, dusty and smoky environments. Ultraviolet light, which is believed to cause pterygium, may induce chronic inflammatory cells in the conjunctiva or damaged limbal stem cells. Chronic inflammatory cells were shown to be present in the pterygium samples. Thus, chronic inflammation may contribute to pterygium occurrence. And the incidence of pterygium is twice in men compared to women. Different surgical approaches have been suggested for treatment of pterygium. And in that, free conjunctival autograft is a quick and safe procedure, and amniotic membrane graft is another suggested procedure with improved surgical results. The need for conducting the present study is to compare the recurrence rate and surgical outcomes of primary pterygium with conjunctival autograft and amniotic membrane graft. Aim is to compare the recurrence rate and surgical outcome of amniotic membrane and conjunctival autograft transplantation for pterygium. And the objectives are to study the recurrence rate and surgical outcome of amniotic membrane transplantation for pterygium, and recurrence rate and surgical outcome of conjunctival autograft for pterygium, and to compare both. And my study is a prospective observational study of sample size 40 patients done in tertiary care center for 6 months, informed consent and institutional ethical clearance taken. We included patients about 20 years of age and primary pterygium of all grades. We excluded eyelid disorders, recurrent pterygium, pseudopterygium, severe dry eye, and chronic ocular surface disorders, trauma, patients with known immunodeficiency status and prior history of ocular surgery. And patients divided into two equal groups randomly, and one group is for amniotic membrane and other group is for conjunctival autograft transplantation. And routine preoperative evaluation was done. Slit lamp examination of the type and extent of pterygium, uncorrected and best corrected visual acuity, preoperative refraction, fundus examination, and grading of pterygium based on extent, that is grade 1 crossing the limbus to midway between the limbus and pupil, grade 3 is crossing the pupillary margin, and standard surgical technique followed in both the groups, and patients were followed up to 6 months. Assessment includes visual acuity and ocular symptoms like redness, and slit lamp examination for graft position, graft edema, and recurrence of pterygium. And the collected data entered in Microsoft Excel 2010 and analyzed using SPSS 20 version. Chi-square test was used for comparison of both the groups, and the p less than 0.05 considered to be statistically significant. And this is a demographic profile of the study. And this is clinical profile of the study group. We took laterality, location and grading. And the occurrence of pterygium with respect to occupation. And the complications of, we looked for complications like graft edema, dryness, graft retraction, epithelial cyst, granuloma, Dellon and recurrence, and both the groups have equal complications. This study concluded that both the methods were equally effective in treatment option for surgery with comparable recurrence rate and cosmetic results, and either may be selected based on the patient characteristics. And other studies like Sandeep Kumar et al. Concluded that both the procedures were equally effective in terms of efficacy and outcome. In view of increasing incidence of glaucoma, amniotic membrane graft is viable alternative for patients. And other study like Mitra Akbari et al., they concluded that more inflammation and recurrence rate was seen in amniotic membrane group. So it seems CAT is the preferable method, and we can also consider AMT for patients with glaucoma who require intact conjunctiva for future procedures. And conclusion, both amniotic membrane grafting and conjunctival graft method was equally effective in treatment. Amniotic membrane grafting shows encouraging result in extensive tissue repair and in patients who require filtration surgeries. Major drawback of this amniotic membrane grafting was its procurement under aseptic and sterile condition in time consuming and require financial resources. And conjunctival autograft technique did not require financial resources but a highly skilled technique. And these are my references. Thank you. Thank you. equally effective.
Complications were less with even with amniotic membrane graft. So you did not get any graft melt or necrosis, recurrence.
Recurrence in our study, CAT is 1 ma'am, and this amniotic membrane is in 2 cases ma'am. Okay, thank you.